Hi, everyone. Thank you for being with us. We are the research team from the Dominican Republic, and we are grateful to be here at the 66th annual meeting and exhibition of the American College of Nurse-Midwives. And we are looking at our global presentation, our global forum presentation on reducing maternal and neonatal mortality in the Dominican Republic. So with me, I am Nola Holness. With me is Estefania Enriquez, Maria Diaz, and Jasmine Garcia. And together, we are going to be discussing how we went about an educational program to work with nurses in the eastern region of the country towards reducing maternal and neonatal mortality. We are indeed very, excuse me, very grateful to the leadership and the guidance of Dr. Angelica Floren, who is the president of the Dominican Foundation of Mothers and Infants, who has undergirded this project. So without further ado, I'm going to go right into our project. What we looked at was the significance of this project. What we found out was that globally, there are over 295,000 mothers who died in 2017. There were over 2.5 million babies who died globally in 2018. So these numbers are pretty staggering. How much more so in the Dominican Republic? More than 2,800 newborns and over 200 women died following pregnancy and childbirth with easily preventable causes. So, furthermore, we have identified that in the DR, there is a fifth highest maternal death, as well as the second highest neonatal death for the region. And main causes for this would be bacterial sepsis, respiratory distress in the newborn, maternal hypertensive crises, and obstetrical hemorrhages. So do we have a problem? We believe absolutely. Many of these times, though, prenatal, birth, and neonatal care do receive coverage from skilled personnel. So with this discrepancy, there's some suggestion that indeed there is some challenges with the quality of service that these women and newborns are receiving. So therefore, we have found out that it's important for us to find out how can we use the knowledge and skills that nurses need to help them to perform key components of care for moms and newborns towards reducing maternal and neonatal mortality. So that was the purpose of our study. What we wanted to ask the question was, what is the impact of an educational program? So if we decide to have an educational program for these for these nurses, how would we help? How would that program help to reduce preventable deaths of moms and newborns among Dominican Republic nurses, using their skills and knowledge to help to prevent these deaths? As well as we wanted to find out how is the documentation of the management of these preventable deaths in prenatal, intrapartal, and neonatal care. How does the documentation occur in this section of the country, the Eastern Dominican Republic region? So now I'm going to have Dr. Jasmine Garcia talk to us about the methods.
Thank you, Nola. To further explain our methods, our approach was to use a multidisciplinary team of nurse, midwife, neonatologists, and pediatricians to develop a 12-month program, which included a 5-module workshop, web-based chats, video gallery, and key work materials. Those workshop modules included an introduction, preserving the lives of mothers and babies, pregnancy, labor and delivery, and postpartum. The web-based chat was through WhatsApp, where the nurses were able to ask questions as well as let us know in real time how they are applying what they've learned. The video gallery included recordings of the workshops, as well as additional educational resources created by the coordinators, such as a video on sexually transmitted diseases and a how-to video on how to clean incubators. There were also key work materials provided, such as a binder with slides and detailed educational material, as well as donated resources such as stethoscopes, glucometers, blood pressure cups, and disposable materials such as gloves and alcohol swabs. Our target was 30 nurses from 15 facilities in the Eastern DR selected by National Health Services. These 30 nurses completed 10 health forms on prenatal, intrapartum, and newborn care, as well as an after research questionnaire. And now we will continue with my colleague, Dr. Maria Diaz.
Thank you, Jasmine. As Jasmine said, the nurses were provided with a mid-program and end of the program form, which they were able to fill to give us feedback about the program per se. In the mid-evaluation, most nurses had an excellent opinion about the program, as per 96.3% of them said. And at the end, 96.6% believed it was an excellent program. At the mid of the program, 92.6% had their expectations excellently met. And at the end, 82.8%. At the middle of the program, 74.1% of the nurses affirmed it was very likely for them to practice what they had learned during their practice. And at the end, 75.9% stated the fact. At the middle of the program, 77.8% of the nurses found the material sent through the chat very beneficial for them. And at the end of the program, 96.6% of them said it was very beneficial. So we see a jump there, a very high jump from 77.8 to 96.6. They all had a very favorable opinion on the workshop's content, length, organization, and educators and facilitators of the program. And over 90% of the nurses would recommend this experience and the program to their nursing colleagues in order for all of them to have all of the information that was provided. The nurses were asked to mention 3 concepts or skills that they newly learned throughout the program. The 6 that were predominantly mentioned by them was taking adequate care of the mother and the newborn, identifying domestic violence in a pregnant patient, newborn resuscitation, managing the stages of labor as they appear, breastfeeding counseling for the mother after delivery, and hypertensive disorders of the pregnancy. As for what might impede them from putting into practice what they learned, most of them mentioned that the lack of teamwork provided by the doctors does not allow them to or encourage them to practice actively what they are learning. And also a lack of tool and equipment in the hospital that they're practicing in. From the nurse's perspective, the program's strengths are the following. Ongoing support from the educators and between participants provided, as Jasmine mentioned, through the web-based chat and active communication with them. Constant encouragement provided to the nurses. Having a safe space to express themselves and to ask questions. And the educators' willingness to teach them. As per the program's weaknesses, from the nurse's perspective, the only one that they mentioned was the inability of the program to be conducted for the last 2 workshops in a present manner, since since we had to provide the last 2 modules through the Zoom platform due to the COVID pandemic. Now I will leave you with my colleague, Dr. Estefania Enriquez, who will give you the rest of the findings.
Thank you, Maria. I will continue with the findings. During the first month of the program, nurses were responsible for completing 10 health forms in the specific wards they worked at. At the end, we were able to collect 202 forms, and we were able to analyze the quality of the information provided. The idea behind this was to describe the perceived limitations in knowledge and skills, or the possible limitations in equipments, depending on how correct and complete the sections of those forms were. For instance, as you can see here in orange, one of the least documented sections for the prenatal forms was the 3rd trimester Group B streptococcus screening, or GBS screening. And this is something that caught our attention because one of the most common causes of mortality in newborns in our country is bacterial sepsis. And at the same time, one of the most important causes of bacterial sepsis is GBS infections. So we decided to look more information about this, and we made this graph which shows the documentation of GBS screening in 3rd trimester per medical center. So each one of these bars represents one of these facilities in which prenatal forms were completed, and as you can see here in orange, only 4 of these facilities actually had the information about GBS screening, and all the blue parts of the bars are those who did not mention those details in their forms. Because of this, the foundation decided to continue working, describing what the gap here is, and we're now working on a program regarding GBS to discover what are the mainly issues. If it's just a documentation issue, which can be easily fixed, or if we have a problem about lack of equipment to conduct the tests whenever it's needed. Having completed these findings, we would like to share our discussion and the team's conclusions after completing the program. We identified the need for professional training, and we confirmed the need for follow-up to narrow the gap between these communities and effective quality healthcare. Also, we confirmed the need for more surveillance in this facility, especially from the information gaps we saw, especially regarding GBS. We also were able to see how a number of factors can prevent nurses from carrying out their work in the way they would like to do it. For example, the organizational conditions, the safety, infrastructural, and inequality conditions that we were able to see throughout the presentations. And these are situations that threaten the quality of the care they give to patients. And another important factor, as Maria mentioned, is the fact that they don't feel as valued as they should be. And this limits how well, in the end, they are able to share their knowledge to save the lives of these mothers and babies. Also, after the education program, especially after having received the feedback forms, these nurses highlighted that they were not only able to master important concepts, but also they were able to practice their resilience, and they felt empowered after having completed the course. And this is something we were able to also confirm by discussing with them. And as a team, we concluded that providing nurses in our country with these knowledge, skills, and also encouraging them to provide the adequate, competent care to these mothers and newborns could really contribute to reducing maternal and neonatal mortality. Thank you so much for the opportunity to present this very special project here. And we would like to acknowledge the contribution of our research team, especially those who are not able to be here in this presentation today: Gabriela, Miguel, Tanya, and Maria and Jasmine, who you just met. And of course, Dr. Angelica Floren, who was the mastermind behind all this and who was always there to support us throughout this project. Thank you so much.